this is a good one if you're still researching the type of business that you want to get started, especially one that'll be as flexible, working from anywhere, 24/7. You can work at 3 o'clock in the morning if you want to, because the internet doesn't close.
That's right. Yeah. Well, Patrick, I think this is one of the biggest crowds we've ever seen on our webinar. So we have we're amazed by not only the interest, but folks that are actually getting into our training classes.
It's a good year. I think the business atmosphere is all up all the way around. And, with all the changes that are probably coming with the new administration, who knows what will come, but we know this. There will always be people getting sick, going to the doctor. The doctor needs to get paid. Somebody has to bill somebody to get the doctor paid, and we're just in the right place at the right time.
Absolutely. I mean, I know we've all gotten the question, Patrick, well, what happens if something happens with the Affordable Care Act and it gets pushed to the side? I think that's a topic you and I are going to be talking about here in the next couple of weeks.
Yes, we've got a specific webinar coming up in 2 weeks. Next week, we're going to be doing an interview with one of our successful licensees, and then the following week, we'll probably do one on that very topic. But here's the bottom line, folks. The Affordable Care Act is in place right now. It probably will still be for another year, year and a half. I mean, it can't be completely eliminated all in one fell swoop with a pen. But if it is, for example, it only takes us back to where we were before it was implemented, which was doctors still need help in getting paid. And we're the ones that can help solve that problem. I have been doing it for 23 years. Nothing will change for this industry. It probably just means that many more claims.
Yep, absolutely. Folks, we want to let you know that we're going to have a printout of this webinar today. You'll see this at the end of the webinar today. We're going to have the entire slides of everything. So if you've got a business partner that you want to share this with, you can print that out a little bit later. But we want to really just kind of get started in talking about really the potential money that can be made in medical billing. And Patrick, I know that a lot of people ask this question because some are trying to figure out, can I do this part-time and just make enough just to maybe take care of some incidental bills, or just want to kind of get up ahead a little bit than what they're making just at the regular job? Or could it completely replace their income? This is a great question that a lot of people do ask.
Well, and that's why we use that term, the potential money in medical billing. There is money to be made in medical billing. Those of you who have heard about this business, it's been around for years. My wife started doing medical billing back in 1987. So it's been an industry around for a long time. But if you've heard of somebody else who's in this business, you may not realize the type of money that they're making. We're going to peel back and show you behind the scenes what this, what I call a secret business, what the potential is. It might be bigger than you think.
Yeah, absolutely. But before we start talking about that, people always want to know, Patrick, is doing medical billing, is it still a real business?
You know, that I like the way you put that in quotes. Is it a real business? And there's a lot of businesses out there that I think of as fads. They come and go, right? There was one franchise being sold about 2 years ago called Gum Busters. It taught you how to scrape the gum off of the tables, underneath tables. You know, the gum that people sit at the table and chairs and things like that in theaters and on the walls and so forth. And, that came and went real fast because that's not going to be something that's just going to stick around very long. Get it? Stick around?
Right.
Well, anyway, the point is, this is one of those real businesses that, again, it's not only been around for a long, long time, but it'll be around for a long, long time to come because it's based on a real need in the marketplace. Look, the dollars are flying out of this doctor's portfolio here. We're the people that teach you how to go capture those dollars. So anything that has to do with helping doctors to earn more money, bring in more money, keep more of their money, that's got to be a good, solid business to be in.
It absolutely has to be. And, I know that for people that are entrepreneurs, they're always looking at different magazines, trying to figure out what businesses they need to be in. Here's one of the latest articles here from Entrepreneur Magazine, one of their publications. And I know that's kind of leading us into, again, is this a real business? And Patrick, why don't you talk a little bit about what Entrepreneur Magazine has done with starting your own medical claims service?
Yeah, Entrepreneur Magazine's been around for 30 years, and so it's not something that you should take lightly. What they say should be taken as a pretty good thing, and they have an actual startup manual or book. It's actually a book. I've got it here on my shelf somewhere, and there's a picture of it right there that's on how to start your own medical claims billing service. So that's how solid and how real this is, that Entrepreneur decided to publish a whole book on it. But look at this quote here. It says that the market for medical claim billers is growing exponentially with legions of providers, they're talking about doctors, and an ever-expanding patient pool, that's for sure. Every year there's more patients. Healthcare industry spending is expected to grow by 5.8% each year through 2024. Now, Eric, there's not many industries out there, I mean, not many at all, that have that kind of growth percentage every year for the next, whatever that is. It's a long time, isn't it?
It's over the next few years.
Yeah.
We're going to actually show some. I know that we're looking at the trillions of dollars that are actually spent in there, but this is their research, and part of their research is they put that in this particular book. They've also have listed American business systems as the opportunity, the business opportunity to look towards and getting started in medical billing.
Yeah, so folks, and again, we didn't pay for that. In fact, it was kind of a surprise to us when we first saw that a year or so ago, wasn't it, Eric? We thought, well, how did we get in there? They found us. We didn't find them. And they put that information in their book because we are one of the solid companies that have been out there doing this for, again, 23 years, as Eric said earlier.
Yep, absolutely. Then if asking the question, is this still a real business? There is a company out there called Black Book Rankings. Some of you may have seen this in some of our previous webinars that we've done, but actually this is still true. This is still one of their high parts of what they like to say about that, 42% of all physician practices that are employing billing staff. Now, this is the thing that people always ask me and the rest of us here. What if the doctors already has their own billing staff, or why would they even want to outsource? Well, they did their survey and said that 42% of them hope to outsource their billing within the next 12 months. So it definitely is a real business for entrepreneurs that want to get involved in medical billing.
Yeah, when you go out and do what we teach you to do to locate your first clients, you'll see that a lot of doctors are employing their own staff, and they think by keeping it in-house they have more control over what they're doing, and they even probably think they're saving money, right, Eric? But they're not. We can show them that. That's part of what we teach you to do, is to help analyze their practice and show them, bottom line, that you can save them money and bring in more money for them. So 42% of any market is a big chunk of the market out there, so that's a great statistic there.
Victor just said in the question box there, he says, I suspect the large growth is due in part to the baby boomers that are aging. We've talked about that several times.
Yes, I'm amongst those. I don't know if you fit in that or not. Were you born between 1949 and 1964?
Yes.
Yeah. So yes, as people get older, they go to the doctor more. Parts stop working. I can testify to that. And as those parts stop working, you go to the doctor. You have more disposable income usually, and so you just have more time too to go to the doctor. And so yeah, that's booming right now for sure. And then what's this chart here, Eric?
This one's just talking about the money that is all together, and then kind of where it's spread out here. And this is to help answer some of the questions that people ask. Are we going to be doing hospital billing? Are we going to be doing doctor billing? You'll see that 32% of that $614 billion annually is bundled up in the hospital part of it, but there's still the 20% that's what's called the physician and clinical billing. That's where we're focusing in on, Patrick.
Yeah, that's a big chunk of a big pie. $614 billion annually. Eric, I tell people all you need is so thin a slice of that pie that you couldn't even see it almost, and you'd be making a really good income.
But one of the reasons we like to show this here is because a lot of people do ask, Patrick, well, can I use the iClaim platform for dental billing?
Yeah, and as you can see, the dental is what, 4% of that pie. It's not very big. Now, let me say this. Yes, there are online, web-based, cloud-based billing systems for dentists. But folks, it's a very small market that's out there. We tell people this: look, go after the medical physicians and doctors and clinics that are out there. And once you've signed up all those in your area, then you might want to concentrate on the dental. It's very small. Very few people have dental insurance either. So,
And another one that gets asked real quickly that before we get off this is the home health care. And you can see, folks, that that's only 3% of the entirety of the pie there, too. So we really do focus in on the physician part of it. This is one that we talked about just at the end of last year, because this is one that Adam found, a report that Adam found, again, of the continued growth that's in the revenue cycle management part of what we actually do.
Yeah, so the revenue cycle of a doctor's office has everything to do from the moment that the patient registers online till they get paid, the doctor gets paid by the insurance company. That revenue cycle is what you're helping to manage. So you might call yourself a medical biller, but you're really a revenue cycle manager. And that market alone, it says, is worth $80 billion by the year 2021. That's only 5 years away.
Yeah. So, folks, it is only increasing. And as you can see here with this quote, what the experts are saying, that the average physician could increase their monthly billing by 30% if their medical coding was done accurately. The great thing about our system, Patrick, you and I know this, but for those that are kind of worried about, I'm not a medical coder, do I have to do coding? We can actually show you that the system, the EMRX system, actually does the coding for the doctor. So that's what we're talking about here. If the doctors can use the EMRX platform, they alone could actually end up seeing about a 30% increase just because the system is properly coding it correctly for the doctor.
Yeah, so you don't have to go take a course in medical coding. Everybody knows there are codes involved, and there's, gosh, I don't know, thousands. I don't know how many thousands, but there's a bunch. And you don't have to know any of those because they're all built into our system. And so the doctor has access to all of those codes and can make his decisions based on what he inputs as he sees the patient in our electronic medical record system. So it's a beautiful way to get into this business without having to learn anything about the medical codes. Now, you do need to know how to use our software, and that's part of what we teach you in this week of training down here in Dallas.
And Patrick, you found this one from the New England Journal of Medicine about how much money is actually wasted in just administrative billing costs and expenses.
Yeah, 24% of the doctor's revenue is spent on actually handling that paperwork in the office. Well, folks, nationwide, as we'll talk about here a little later, you'll be able to charge anywhere from 5 to 8%, sometimes 9, 10%, depending on the doctor, the type of doctor, and the volume. But the point is, it's a whole lot less than 24 cents out of every dollar. So you can take that away from the doctor, let them focus on what is their core competency, which is seeing patients and helping them get well, and take all that away from them and save them money at the same time. It's a win-win for everybody.
So as we kind of wrap up this section, we're just, again, kind of coming right back to this slide here, just asking you now, do you feel like this is a real business for you? Because, folks, hopefully, this is just not what ABS is saying. This is what the experts are saying. This is what business articles are saying out there. So now what we want to do, we want to kind of start bringing it in here real quickly. Before we do that, Patrick, let's just really quickly look and see if there's any particular questions we need to get to. There are some questions that are coming in. Folks, we want to encourage you to ask some questions, and we'll do our best to answer some of those questions. But before we actually start getting into what someone could potentially make with just a regular family doctor, I thought maybe you and I could just glance over and see if there's any particular questions we should kind of go over real quickly.
Oh, sure, yeah. Let me open up that question box here.
Yeah, I see one from Ryan. Are partners allowed, and can you only send one partner and the other one learn online? I think he's talking about the training class. So can more than just one person come to the training class, Patrick?
Yeah, sure. Now, depending on the number of seats that are open as we get close to the date of the training, we will allow someone to bring a partner or a spouse for an additional $1,000. That is all dependent on the seats that are available, though, and sometimes those seats go really fast. So, folks, if you're doing your due diligence and looking into this business, just do all the due diligence you can as quickly as you can so that you can at least get back with your ABS coach and tell them that you want to be in that March class.
There you go. There's some of these that we'll save towards the end because it has to do with some more things about training, but here's one that I found from Angie. Angie, you asked your third question that I see here, how much do you charge doctors for billing services? And Patrick just mentioned that. So we want to make sure that you kind of get that real quickly. It's going to be anywhere from 6 or actually 5 to 7 to maybe 8%. Folks, you won't know what that number is until you do what we call a practice analysis. Patrick, you want to just really briefly talk about what a practice analysis, and then we'll jump right in here and talking about the potential money being made.
Yeah, well, over the years, we've decided that what we don't want to do is walk in and try to sell anything to a doctor, right? That's a tough sell just because of the situation. However, you can be a consultant by asking questions. And we've come up with about 3 pages of questions that you can go in and ask the doctor. Sometimes you're doing this with the office manager because they'll know the answer to most of the questions. And by gathering that information, doing what we call a practice analysis, you're going to be able to go back to your office, prepare a report using some software that we have available, basically a spreadsheet template that you fill in the blanks, and it will produce a report that will show the doctor, bottom line, in black and white, exactly what you can do for that practice, how much more money you can bring to them, how much money you can save them. And if there's money to be saved, the doctor should at least be interested in taking a look at it.
Absolutely. All right, so folks, this is the moment I think you've all been waiting for. We're trying to get as many questions as you can see we want to handle, but we're going to go ahead and jump in here. So folks, as you're looking on the screen, we're going to pull up a doctor. We're going to say this is a regular general practitioner. And Patrick, I think it's been from our research that we've all done here at ABS and kind of polled a lot of our licensees. I mean, the doctor can see obviously as least amount of patients that they want to see in a day, and they can see as many as they want to see in a day. But I think what we've seen is on average that a doctor might see about 25 patients a day.
Yeah, if you've ever waited in a doctor's office, sometimes there's 25 people waiting there the hour that you're supposed to see the doctor, right? Because they overbook like the airlines. You go into a little room, and the assistants there take your blood pressure and temperature and that type of thing, and they're getting you ready to see the doctor. Well, the doctor walks in, and boom, in 5 minutes, he or she is in and out of the office, right? So it's pretty simple for a doctor to see 25. That's very reasonable. Some chiropractors can see 50, 60 patients a day.
Yeah, absolutely. And we'll even see as utilizing some numbers from one of our licensees on the specialty side that we'll see that number actually kind of go up. But what we're going to do here, folks, is we're going to talk a little bit, first of all, about the doctor, what their expectation is, what they're trying to get their money, what kind of money that they're looking for. And as we're doing that, we'll use those numbers to show you what you'll be making as you're going along. So, Patrick, first of all, when the doctor is seeing their patients, again, now these are some numbers that we have polled our licensees from, and we all know, pretty much everybody on the call, every time that we go see the doctor, it's at least $100 to go see any doctor, really. So we're not talking about a specialist here. We're just talking about a regular family practitioner. I don't think anybody can get outside of a doctor's office less than $100 now.
No, that's a good average. There are some doctors that are charging more, some less, but we just use averages in these numbers to kind of help you follow and make the math simple, basically.
Yeah, absolutely. So if you had 25 patients a day at $100, you can see that the doctor is looking at trying to just meet a bare minimum of maybe about $2,500 per day. So as we're going to kind of go through this, we're going to be basing this upon this is how much money this doctor is looking to get back from the insurance companies. Now let's talk about this real quickly because, Patrick, I know some people think, well, that's just maybe from United Healthcare or Cigna or whoever else might be out there, but we're actually talking about from Medicare and Medicaid too as well.
Yes, you can do billing for any doctor that bills Medicare or Medicaid. And, of course, all the commercial insurance companies out there. Medical billing is pretty standardized from across all 50 states. And, by the way, there's no license that you need to do medical billing. The training and certification that we give you is all you need. and we've been doing this again for 23 years. So we got this down to a fine art. But $2,500 a day. Now that may sound like a lot of money to a lot of people, but folks, that doctor has a lot of overhead too to cover. So that's not his net.
Yeah. Yeah, because once you start doing, like Patrick mentioned earlier, you start doing that practice analysis, you'll find out how much money is actually going out the door. And then some of this money is not even collected. So we're only talking about if the doctor gets 100% of all of his claims paid. Would you agree to that, Patrick?
Yeah, you'd have to have 100% of all those claims pass the insurance company's scrubbing process. And believe me, they've got people there at the insurance companies that are trying to find reasons to deny those claims because they want to keep the money.
Yeah, absolutely. And the latest reports that we have from our system, we're less than 2% on any claims being rejected, and we could possibly even say less than 1%. So we're really close to these numbers here. So also we're going to take that $2,500, and we all know that on average every month there's at least 20 billing days per month. So you take that $50,000 per month, that's the expected revenue that the doctor's looking at getting. And what Patrick said, we think $50,000 is a lot. Well, it's a lot for us because a lot of us may be just making just a little over that every year. But again, the expenses that doctor has, all the malpractice insurance that they have to pay, and their staff, and all the other things that they have to pay. So, and if you think about that, folks, if they're doing this is something good to quickly talk about. If they've got two billers that they are employing, Patrick, that could be $3,000 to $5,000, if not $6,000 a month just in employee expenses.
Oh yeah, it eats it up real fast. And then they've got the overhead, the insurance, the equipment updates, all kinds of supplies that they use. There is a lot of overhead in running a doctor's practice.
Yeah. So don't let this big number kind of fool you, because actually, folks, from our experience and what Patrick gets to talk with a lot of our licensees and spends a lot of time interviewing them, this number is actually a low number.
Yes.
On a regular monthly basis.
I interviewed Albert Ramos a couple of weeks ago, Eric, and
right.
he even said that he was doing with one group of doctors, they were doing over $100,000 a month. So
yeah, easily. All right, so now we're talking about what are you going to make out of this? So now the doctor has to pay you because you've helped that doctor collect that $50,000. So what is your take on this? What are you going to make on this? So let's just
before you go on, Eric, let me just touch base on that number that I used earlier, that 5 to 8%. That's one of those numbers that we just know from, well, we've got licensees from coast to coast in every state, so we know what the average is out there. Depending on the type of doctor and the volume, the specialty, and so forth, that can vary. And we help you with that pricing, by the way, because we don't want you to leave money on the table when you do the proposal for the doctor. We're going to help you price that right. But anyway, based on that, we've used, I think, a figure of 6% here, haven't we, Eric?
Exactly. That was a great lead in to what this is. So if you take what the doctor's making on a regular basis, about $2,500 a day, times 6%, your average earnings per day, if you're looking at it per day, of what you're trying to make per day, that's roughly going to be about $150 per day. Now, here's the question, Patrick, that always comes after that. Well, how much time is it going to take me to do this type of work?
Yeah, so remember, you're only talking about 25 claims, right, that you processed during that day's time there. And Eric, I mean, even if they had to put all of the information in every time, which they don't, of course, the first time they have to put in the patient data and the insurance data, but after that, all they put in is a date and a couple of codes, right? It doesn't take that long to do a claim. So what would you think? 25 claims, even from scratch, shouldn't take you more than 2 minutes a claim. That'd be 50 minutes. That's less than an hour.
Yeah, so you can see, folks, we've really blown this number up, because even if you did take 2 minutes per claim, it's going to be less than an hour. But let's just say that you really like to kind of henpeck through the keyboard there. Let's just say that it took you an hour and a half. So for an hour and a half a day, you could literally be making $150 a day. So for those that are looking at this for a part-time business, Patrick, this is very achievable.
Yes, and by the way, that's a bargain for the doctor too. We saw earlier that most doctors are spending about 24 cents out of every dollar. That's 24% versus 6%. So again,
Right.
a win-win. You make money, the doctor saves money. Doesn't get any better than this, folks.
Yeah.
It's kind of like if you did have to go out and sell this, it'd be like selling popsicles in the Sahara Desert.
But Patrick, the hardest thing though that we always hear is we just got to get that first doctor, and that's why I think we're going to show folks at the end of this webinar how much easier we've actually made it to get in front of the doctor to actually do that practice analysis. So everybody hold on. We're going to show you how to show this information to the doctors here. But let's wrap up here. So your average earnings are going to be $150 a day times 5 days per week. That's going to give you about $750 a week times 52. That comes out to $39,000 a year. So again, Patrick, for a part-time business that could literally take you less than 2 hours a day, a lot of this could pay, the mortgage for most people.
Yes, it's not a bad revenue from, like you said, a part-time business doing it 90 minutes a day. Even if you double that, folks, the numbers still work out to where you're making a nice hourly wage for the work that you do.
So what we want to do now is if nobody's ever gone out to our website, we're going to take you there right now. We've already kind of got it. If you go to our website, we're going to go to absystems.com. For those that can kind of do this and watch the webinars together, you can certainly kind of know what we're doing here. But you're just going to go to where it says income potential, and we're going to go there just real quickly. So let me get that up and pull that up for us. Just give me 1 second. I'm going to just open up a new window over here on my side.
So folks, this is at our standard website, absystems.com. And like you said, up there at the top, income potential, and you'll see a little thing called the calculator, the income calculator. So yeah, he's actually live now on the internet showing you how this calculator works.
Yeah,
so let's talk about numbers here, Eric.
Yeah, let's go ahead and play around with this. So let's put those same numbers that we were playing with. We've got one doctor that will see 25 patients, open 5 days a week, 6% at $100. At that point, folks, all you got to do is click submit right here, hit submit, and you can see there's not only your yearly income, but what we said of $39,000 a year for one office. Your average monthly gross income could be $3,250 a month. Patrick, again, for a part-time business, that is pretty doggone good.
Yeah, and we've put those numbers in there. You saw him plug in the numbers we were using earlier, but you can plug any numbers you want to in there. If you think you want 2 doctors as clients, then put a 2 there at the very first, and so forth. Just go through it and play around with the numbers and see what numbers you come up with. Because this is all based on our history with our existing licensees, so we know that the numbers are accurate.
So, folks, if you're looking back at my screen here, go to our website, absystems.com. You can follow where my mouse is going. I'm going right here where it says Income Potential. Go to Medical Billing Calculator, and that will bring you straight to that spot right there. So we're going to hold that there, and we'll come back to that in just a moment. And let me get back over to our slide presentation.
Eric, while you're doing that, I'm going to read a question here from Victor. He says, my understanding is that ABS will create the marketing materials for us. Is that correct? I'm interested in that because I'm short in the marketing area. Okay. So, Victor, you are absolutely correct. In fact, we've spent over $100,000 developing the marketing materials, and we're going to show a couple of them here in just a moment. That you'll be able to use as an ABS licensee. So yes, we know that the hardest part of any business is getting clients. We know that that's the scariest part for most people. And we've taken extra care and spent extra money developing tools that allow you to do that a lot quicker than you could if you just tried to start a business on your own. They're proven tools, yeah.
Yeah. Okay, so folks, here we go. Now we're going to use some numbers from a real licensee that was billing for a specialty for urology, we got their numbers, and they said on average this doctor was seeing about 40 patients a day. Now, that almost seems to be a little bit more realistic for all of them, simply. About 20 patients in the morning, 20 patients in the afternoon. Some people are just coming in for maybe a few injections. Some people are just taking care of some follow-up visits, maybe from a past surgery or something like that. But, you know, their schedule held about 40 patients a day. I think, Patrick, this is what, again, like I said, we're probably all most accustomed to, is seeing that kind of volume in doctors' offices.
Yes, and for a urologist, believe me, all they do is come in and sometimes just take a little test, real quick test, and it doesn't take very long at all. And I don't see my urologist but about 2 minutes, I think, total. So he moves pretty quickly from room to room.
From room to room, yeah. All right, so now we're going to take those same numbers here, and then this time the average reimbursement is about $175. So you got 40 patients a day, an average reimbursement for each of those. Now, you got to understand that most urologists are also doing some minor surgeries. They're doing removal of kidney stones and things like that. So there's going to be some surgeries mixed in there too as well. But remember, sometimes it's just a follow-up visit. So all these visits, when you move them all together and you average them out, comes out to be about $175 per patient in reimbursements over a month's time. So this doctor has this expected income of right around $7,000 per day. So this ought to be piquing some people's eyebrows up already.
Yeah, because this is more common than you'd think. We used a general practitioner earlier to show you $100 claims, but more than likely, if you go after the market that we teach you to in our workshop, you'll be going after people like the urologists who bill, you know, higher volume. That's what you want, of course, because you make a percentage of that.
Yeah, because with the $100 doctor, that was $2,500 a day. Now you're at, you know, this specialty at real numbers here. Now you go from $2,500 a day to $7,000 a day of what the doctor's expecting there.
And it's the same work. It's the same amount of work, exactly.
It really is, and it's the same amount of work actually doing the billing. It's really not even different than that. So again, the doctor is trying to get $70,000 close to that on average. And folks, we know that it can be a little bit lower, it can be a little bit higher on certain days. We know that. But this is the money that expected to be rolling in from the insurance companies, Medicare, Medicaid, Blue Cross Blue Shield, all of them getting back, reimbursing back to the doctor. So we take those $7,000 per day, again, an average of 20 billing days per month. That's $140,000 per month in expected revenue for the doctor. One doctor. Now,
one doctor. That's all we're talking about here.
one doctor. So again, the doctor has to pay you. So again, let this kind of sink in. For the same amount of work that you were doing that other billing, you can leverage your time by going after specialties. Because a lot of people ask Patrick, well, I think I'm going to go after my chiropractor. That ought to be the quickest win for me. Well, remember, they're going to do a lot of volume of claims, but their dollar reimbursement's real low. So this is kind of that middle of the road, that sweet spot of working with particular specialists. So now the doctor has to pay you. So we're going to run through that. $7,000 a day times 6%. Your average earnings per day is $420 a day. This time, it's going to take you a little bit, maybe a little bit longer, but still about 2 hours a day.
So, folks, this is what the question usually is asked, well, how do I get paid? Well, basically, in our system, you're going to see exactly how much you billed that doctor for to the insurance companies. Then you'll simply do a 6% of whatever that number is and invoice that doctor for that amount.
Absolutely.
And that's how simple it is. They'll either send you a check, or some of them let you put it on their credit card each month, just automatically.
So again, and looking again, what you're making out of this, $420 a day times 5 days, that's $2,100 per week times 52 weeks. That's $109,000 per year, Patrick, with one doctor.
And again, we are talking about one doctor. Now, how ambitious are you? How large would you like to, build this business? Eric, sometimes we show them how to go out to our website and actually find out how many doctors are in their area. And if you do that and use our little Google tool that we have out there, folks, you'll see probably in your area there are hundreds, if not thousands, of medical providers of all sorts of specialties. And by taking that, yeah, I think there's Eric showing it there on the website now. I think it's under that income potential too.
Yeah, I'm just showing these numbers that again how we got there. So folks, again, if you want to plug this number in to your into there, we use one doctor, 40 patients a day, 5 days a week, 6%, 175. You're going to get $109,200 a year, almost $10,000 a month.
Yeah, and notice he didn't change that percentage. Sometimes for specialists like this, you can get more because, again, they're making a lot of money. And they can, you know, it's all a matter of figuring out how do you price something. You don't want to be what I call the Walmart of the medical billing companies in your area. I mean, you could put that down to 5% probably even, Eric, and they could still make money.
We're going to move this down to 5%. If people are kind of going, they're kind of freaking out going, wow, 6% seems like a little bit too much. Let's put 5% in there. And even at that is $91,000 a year, $7,500 a month. So again, for less than 2 hours a day, you know, even if you took it to 3 hours a day, folks, even if you just got one specialty and that's all you did, folks, Patrick, this could replace most people's regular income right here.
Yeah, so again, folks, we have all these disclaimers on this site here that is just saying basically that these are not what we're promising that you can make. It's just what the potential is and what the probability is if you just get out and, you know, sign up doctors, because we've got licensees making this kind of money. A lot of our licensees have told us that they make more than the doctors that they do the billing for. So it's a very profitable business. In fact, Eric, we have had a couple of doctors over the years actually sign up, just quit being a doctor and get into medical billing because the money was here.
Right.
I think that speaks volumes for this business, don't you?
I think it does. I think it really, really does. And it kind of shows you that, first of all, folks, what Patrick and I tried to do earlier, we just try to set the stage. Is this a real business? If it's a real business, what is your really potential income earnings, though, that you can actually make? And hopefully we've been able to demonstrate that for you. Go to the website, check us out, pull that numbers in there. But now, Patrick, what I'm going to do, and you can just chat right here. I'm going to put this back up here. Here are some of the specialties. I'm going to kind of flip through a few of these screens while you kind of talk through some of these.
Yeah, when we say that the whole market in your area is your potential clients, we're not talking about just the clinics and maybe your own personal doctor, a general practitioner. We're talking about every specialist that's out there. And Eric, we don't see that yet. I guess you're working on it, but
let's see. Oh, there it is. Sorry, I had it on showing the wrong screen there.
Yeah. There we go. So, who can be your clients? Well, all of these specialties that you see here, and I'm sure this is just a portion of them. There's dozens and dozens. Oh, there's another screen. He's showing a bunch of more there, and there's another screen, and here comes another one. So the point is, folks, there's lots and lots of doctors out there that are potential clients. You can't run out of clients. It's kind of like, Eric, when I talk about having one or two licensees in an area, it's impossible to flood an area like this because there are so many doctors and more doctors graduating from, medical schools even.
Sure.
So there's just a whole lot of folks out there that they can go after.
So now you can see who can be your client. Now we're going to kind of start churning a little bit and why we are saying why to use iClaim in EMRX, because folks, we're actually going to break this down into a separate a separate webinar later on to kind of talk with you about how it does mobile charting. It helps increase the revenue. It's affordable. It's customizable. One of the great things about it, Patrick, is that it has a complete 100% U.S.-based customer service, which is great for not only for us, for our licensees, for our doctors to know that we can service these doctors from the East Coast to the West Coast, all making sure that we're going to be able to help them. It's web-based, it's integrated, it's certified. It's been around since 1998. It does all specialties, and you know what? It's again won all these different awards too as well.
Yeah, and folks, it's not all about the software and the technology, of course. A lot of it has to do with not only how to get clients, but how to keep clients, how to get referrals from your existing clients, how to use your referral network in your area to build your business, and how to continue learning, because there's always something new to learn in this industry. So part of our license fee that you pay, we call it a lifetime license fee, because you never pay ever again for anything directly to ABS. There's no user fees, there's no updates or upgrade fees to the software. Since it's cloud-based, we just update it on a constant basis, and every time you log in, you're using the latest version. There's no hidden fees, including the training. So part of the training is done usually on a Friday. We do webinars. We've got one this Friday, for example. That's for our licensees, and there's never a charge for that. You have a lifetime ongoing training to keep up to date with what's going on out there.
And the technology part of it, Patrick, is just it's second to none. I mean, there is just no other technology that's out there that can compete with the technology. I know that you mentioned it's not all about the software, but then there's part of it that it is about the software. And we not only we have all that, but then we have other services. We've just spent nearly 50 minutes just talking about the income potential that you can make with iClaim and EMRX. We haven't even talked about these other services.
Yeah, and so because these other services they're not, first of all, they're not going to make you as much money as the medical billing. The reason you have all these other services, though, is because sometimes you can get in the door speaking with an office manager or a doctor by bringing up something like maybe the fact that they might get fined by Medicaid or Medicare for $10,000 for an infraction by overcoding or something like that. Well, we have a service right here called Audit Guard that will allow you to make money at the same time protecting the doctor by providing audits, pre-audits we call them, of his code to make sure that he is in compliance with the codes and not overbilling. It ties directly in with CodeWrite, which is another cloud-based application that allows the doctor to basically give you the idea that they want to know maybe some more about their coding, and we have certified medical coders who can provide that service for you without you having to know anything about the codes. You charge a fee to the doctor for that.
Yeah, and Patrick, this is a great one because this can be used not only by the doctors themselves and help them build their business, because this is another way of increasing the cash flow for that doctor's office, sending out reminder cards. But this is a way, again, our licensees can actually use it for part of their marketing, and they're going to make money on top of that as well. You want to explain the auto card too as well?
Yeah, well, as it shows there, it's just an automated follow-up system that you access via the cloud, and it has thousands of professional full-color greeting cards and postcards. Now, these are not e-cards; they're literally cards that that are printed in full color and mailed out to your potential doctors and potential clients. You can personalize them. You can schedule them to automatically be sent out each month or every 2 weeks or whatever. And you can also offer that, of course, like Eric said, to the doctor to help them follow up with their patients. It's just a terrific system. When you see it, you'll be blown away and wish that you had this. If you're in any other business, you need AutoCard.
Yeah.
And by the way, it could be marketed to any business out there that needs an automatic follow-up system too.
And so can Quick Collect. This one is another one that could be used both for regular doctors, but this is another service that could actually be used for other types of businesses. And we'll really get involved in this type of information, the profits that you can make out of this during our training class. But and same thing here with ChoicePay. So there's a couple of different, all these ancillary services that we have that can help you either, like Patrick said, get into the door or talk to the doctor a little bit more about it. But here's one that, again, this is one that can be used for doctors and other services. Like could be one that can be used for dental services or nursing homes or schools or churches. Talk real quickly about this because we actually use this.
Yeah, in our office, when you come down to visit, ask Hannah, when you walk in the front door, ask her to see our file cabinets. We used to have a wall full of file cabinets with all kinds of paperwork in it. We've gotten rid of all that now. All of our paperwork is stored in the cloud in iDocs Now. It's a wonderful system because, Eric, literally, Hannah can scan in paperwork from the office. I'm here at my home. I can access that same paperwork immediately. Once she has uploaded it, immediately I can search for it in iDocs Now and look at it and bring it up on my screen, print it out, mail it to someone else, whatever I want to do. It beats paper all over the place. So this one's hard to explain, but folks, all those files you see in the doctor's office can be turned into electronic files, and there's big, big money in doing this for the doctor.
Now, Patrick, we're kind of getting close to the end of the hour here, but I'm going to pop over to here real quickly. I'm going to talk about one of your books, and it's the one that we kind of got showcased right here in the middle. It's this new Thriving Medical Practice book. Let's start talking about this because I know people are thinking, how do I get in front of a urologist now? How do I get in front of some type of specialty?
One of the ways you do that is you position yourself correctly. And what we do is help you position yourself as the expert. The expert is the person in an industry that can help a person who's looking at their product or service to be more knowledgeable. And so we've written these books specifically for the doctors, but we've tied you in with these books, as you'll see here. For example, we have a way now of actually printing your name on the front cover of the book. You can write the foreword yourself, or we have one that's pre-written, and you can put that on the front of the book. So folks, look at this. You are actually now a co-author with me and Dr. Vicki Rackner. You've partnered with a doctor. It doesn't get any stronger than that from a marketing standpoint. So this book is an actual book that you can buy on Amazon. It's $24.95. You'll be able to buy it for about $5 a copy with your name on the front and on the title page. And as you can see, your contact information is right in there, right at the end of the two-page forward. So here's one of the ways that you can relax and know that ABS knows what we're doing when it comes to marketing. We are positioning you as the expert with this tool.
This is ingenious, Patrick. This is your brainchild. I mean, all the way. So kudos to you for pulling this together and then partnering with Dr. Vicki Rackner and putting this book together. We're hearing such great successes of where people were having struggle getting past that gatekeeper. With this book, it's just blowing the doors off of doctors' offices, and these doctors are getting this copy. And I think you've got a copy there to kind of show with some of the tabs. Is that what you want to show real quickly? Or do you have one that has that like that?
I don't think I have a tab one here. But what he's talking about is when we go through the training class, we actually have pages that you can highlight in the book. So we show you the exact pages to highlight, passages, and then we use little tabs. I think I've got one on this book here that I'm actually using as a bookmarker, but as you can see, you can buy these little stickers and stick them on there so that they stick out at the edge. And you'll have several of these. When you hand that book to a doctor, they realize that you've marked something at this page, and when they open it, they actually see the highlighted page that has a quote on it. And folks, it's powerful. This book, by the way, is Dr. Rackner's latest book. She just came out this one called The Myth of the Rich Doctor. She's prolific. She writes a lot of books. And the doctors are eating this one up, by the way. We're gonna use this as a marketing tool too, Eric, as we develop a way for the licensees to put their name on the front cover of this book as well.
Unbelievable. So folks,